So last time we completed some good case, and though I could not answer all the questions because of the next webinar. You can start asking me what questions are pending so that I can finish that first and then start with a new case, or you may start asking questions now only. So we have lots of people online now. You can start asking questions. Good afternoon, everybody. So there was a very typical question asked by one of the doctors, that whenever the taste is altered, whenever the taste is altered, is there it is it important to take that symptom for prescription? Now, as I always say that in a given case, of course, what is altered from the normal state is very important, because it becomes then a very PQRS or an important symptom. But when you're prescribing in for a very chronic case and a very chronic a chronic disease which is for years and years, so it's important to take the whole case to understand the whole summary of the case. For example, if the patient says that his taste is very bitter after eating, and whenever he eats something, the bitterness increases. So you can take a very important symptom that the taste is bitter after eating, and you have remedies like natramur and Merxol and steficegria. But only with this bitterness, if you prescribe the remedy, it may only relieve a certain part of a chronic case, but not a total case. So a case taking, a full case taking is important for a very close simile, or for the simillimum. But of course, there are some tastes where basically, if the patient comes and tells you that there is a lot of mortification, and because of that the taste it is bitter in taste, then it's only one remedy. Mind and body is working at the same level, and the remedy is pulsatilla. So there are a lot of, if you see the repertory, there are so many rubrics regarding taste, but only the taste is altered, or the taste is what you call bitter or sweet or sour or salty or sweetish or bloody like. If you prescribe only at that symptom, it may or may not act. So always make sure that you add that mental symptom, and then it will be a good prescription. So I welcome Dr. Arora, Dr. Chatterjee, Dr. Vishaka, Dr. Babel, Dr. Anja Smith. Hello. So I was just telling about the case. Now, there are cases where the patient comes and tells you that my tastes are changeable. Sometimes when I start eating, I think that the food contains salt more, and everybody else feels everything is normal. Sometimes when I eat, I feel that the sweet is more. Sometimes I feel when I start eating, I feel that the what you call the masalas, we say, as the spices are less or more. So in this case, it is a very important symptom that the patient sees, that the taste is changing. And this, I had a very interesting case, at the changing taste, and it was a very interesting disease also. The patient was suffering from a chronic migraine, and this was a very interesting symptom. The patient came and told me. Of course, one of the polygraph remedies for this type of symptom is pulsatilla, and I did give the patient pulsatilla, but it did not give any relief. And then I got a very interesting remedy, a very rare remedy called as Viscum album. I have presented that case in my OPD diaries also, and I prescribed Viscum album in a case of migraine, 1M potency, and the case was taken care of. So in this, the importance of taste comes when the taste is continuously changing. With that, we added some symptoms of Viscum album, and Viscum album gave us good results when pulsatilla I gave and did not give the relief. So this is how you have to interpret the patient's case taking. So we have a question. Dr. Madan, welcome. Female, 29 years, first delivery, C-section 2 months ago. Now weight 90, feeling willing to reduce. Yeah, so there will be a lot of cases, that after pregnancy or after delivery or parturition, there is a gain of weight. Basically, what happens, it is the body's natural mechanism to gain weight at the time of pregnancy and at the time of parturition. And if in this case, it is very important. It is very important. We have a lot of cases, but in this case, I would suggest that the patient should be given exercise and diet. Because if you open the Metermedic, or if you open the remedies Kali Carb, And I have prescribed kali carb to lot many of ladies, and it has not given me good results. In fact, I tell to the patient, do good dieting, good eating, proteinous diet, and then gradually see the changes in the patient. And within a month, you find that the patient is improving. So if the patient improves without diet, only with the medicine and exercise, there's no need to prescribe medicines. Only I had a case where the patient had lost his child, and after that delivery, the patient lost his child, and because of that, there was gain of weight. In that case, I took obesity because of grief and prescribed ignitia, and the patient responded very well. The grief was much better, the obesity came down, and the patient was in balance with nature. But if everything is normal, still the patient is obese, I first suggest the patient to go for a good diet, go for exercise, and gradually if it comes down. If it does not come down, then you have to prescribe a remedy. Only prescribe the remedy if you are very sure. Okay. So one, sir, I had a patient with edema both legs. On examination and test, everything is normal. The patient is a bit chilly. Guide. See, when you have a case of edema legs, and everything is normal. So this is called sometimes postural edema, because of the sluggish circulation or the sluggish constitution. Now you can simply simply ask the patient that if the patient sleeps at the night, the legs are elevated, so in the morning everything is normal. When the patient starts walking, and doing household work and standing work in the office, and then the edema starts, that means it is sluggishness of the body. In that case, the whole constitution has been sluggish. In this case, there are few remedies which are very, very important. Of course, all doctors will tell you first try carbon, because carbon is very sluggish. So if you see carbon, your patient is chilly, so you must think about carbo veg. But let me give you 4 or 5 remedies which I have used in my practice in sluggish constitution where there is edema of legs, and the allopathic doctor had prescribed a lot of remedies for urination like Lasix and all. So by the time the patient takes medicine, is okay, you stop it back to square one. But sluggish constitution, of course, carbon is there, but do think about 2-3 remedies which are very, very useful in your practice. And the first one after carbo veg is capsicum. Carbo veg, capsicum, and third is conium maculatum. Conium maculatum I've seen has a very good effect when the constitution is sluggish and there is edema of the legs. And the patient of conium is also chilly, carbo is also chilly, and capsicum is also chilly. So these are the very important, because you have asked me all the chilly remedies, that's why I'm telling you chilly. Now, if in the same case, if the patient is classically hot, in that case also carbo veg would work because it is hot and cold both. In hot constitution, you must think of carbo veg, sulfur, and the third remedy you should think about is gelsemium. So this is how you have to differentiate. Everything is not related to medicine. Sometimes a change in the mode of living, change in your lifestyles, a bit of yoga exercises, a bit of some aerobic exercise, and the patient comes back to normal. Okay. I hope I could answer your question. And I would like to ask any results with that COVID-19 vaccine, COVID-19 remedy which I had. I think I had coordinated few of the doctors. If you get the result, do tell me so that I can write in my notes that it is working. Sir, 29 females had extreme fear of disease single year, and there make her worry and dreams of fatal disease. It make her panic if started from father death. Tried account but not frightful. See now, Dr. Chatterjee. See, a beautiful question, and you have a very precise question that the patient has fear of disease and fear, and you have the cause also. So you have the cause also, that his father died and that the fear is still remaining. So in this case, if you see the mater medica, there are few remedies which are very, very important in this case. The first remedy that you should think about is ignitia, causticum, and nux vomica. But there are few remedies again which are very rare but very important. In that you must think, which is never thought about, that is nitric acid. Nitric acid is a very, very interesting remedy when there is death of parent, death of somebody, death of somebody. In fact, it is written in nitric acid, death of somebody who is very close, very, very close. It can be a friend, it can be a father, it can be a mother, it could be anyone, but because of the loss of that friend, there is lot of anguish in that patient. I have seen lot many of cases come to me. They have that history of death of a friend, death of a father, death of mother. This remedy prescribed does not work. Nitric acid starts working, because we have been told that nitric acid is very revengeful, X, Y, Z, and that's why you don't think of this remedy. But nitric acid is a very, very interesting remedy. Anguish from loss of dearest friend, and that is nitric acid. This is very, very important, and it is such a beautiful written in nitric acid, that especially suited for to thin and persons of rigid fibers. And the temperament of nitric acid is nervous temperament. This is a very important symptom of nitric acid. Otherwise, nitric acid has been taught as a very malicious, vindictive, angry, quarrelsome, revengeful, hatred. But remember this: nervous temperament and excessive physical irritability. That is nitric acid, and that is a very, very important symptom of nitric acid. That's why it is written elements which depends on some virulent poison. Virulent poison. That is nitric acid. So do think about this remedy, because I have seen this remedy not used as it should be used in these conditions. And as I always say that study the causation. Nitric acid is after continued loss of sleep, long lasting anxiety, overexertion of mind and body. Overexertion from mind and body. And one very beautiful line it is written: overexertion of mind and body from nursing the sick. So you have patients where they come to us and say that my XYZ was very sick, so I have taken care of that night and day, because it was my duty, it was my this, it was my that, so I had to take care. And then you take the rubric precocity and XYZ, and you don't get the result. But nitric acid is the remedy. Overexertion of mind and body from nursing the sick, and anguish from death of a dearest friend. That is nitric acid. So do think about these remedies, because these are very, very interesting remedies, and sometimes you fail to appreciate what is written in the Mathematica, and we have such fixed ideas of some remedies. That's why we sometimes fail by using this type of remedies, which are very, very taught in school in a pattern. That's why. So welcome Dr. Navjot, Dr. Chatterjee. I think I've given the answer. Dr. Vaishnav, Dr. Gopal, Dr. Sangma. See, Dr. Baba, I just forgot to call you. I'll just call you after the class. I have to tell you the remedy. Sir, edema patient HB is 7. Okay, so if the HB is 7, so it is, see, sometimes in low hemoglobin also there is bloating of the body. So then you have to rule out why the HB is low. And there are a lot of causes for low HB. Then you can think about remedies like ferrum, you can think about remedies like nitrums, you can think about ignitia, you can think about sulfur. So there are a lot of remedies for that, So you have to think about that also. Good morning, Dr. Madan. Good afternoon, Doctor. Rubrics for cheerful despite fatal disease and cheerful despite heart disease. Now, see, I would not actually take this rubric that the patient is cheerful despite fatal disease. I normally, what happens if this rubric has to be taken, I take the basic rubric that the patient is very positive. The patient is very positive, that he's taken this as a very as a challenge, and now he's trying to fight out, and he's trying to be very positive, and he's trying to fight out a disease. So he is spreading positivity around it. So I would rather taking that rubric cheerful, I would take the rubric as positivity, because I have seen a lot of cases have very good results with this type of rubric, rather than basically having that cheerfulness in spite of disease. So I have not got good results in those. So do take the rubric this type, and you will get good results. One more questions. I hope you are, and of course, in then there are a lot of remedies for positivity, and you can always go and enter the case from this rubric. Good afternoon, Dr. Babu, Dr. Madan. Thank you very much, sir. We'll definitely try nitric acid because of you can learn such uncommon medicine. This type of case. Yeah, yeah. No, I'm not. I was just telling you something about nitric acid because see, there are a lot of students. There are students who are working with me, so they also sometimes don't appreciate that symptom, and then we can not able to give that remedy, though the remedy is indicated. That's why. Yes. Next question. I hope Dr. Lisa you got the answer. Sir, remedy for high systolic and low diastolic with high cholesterol level. See, basically, whatever remedies you are using for that. Cholesterol, and if you have seen my lectures of cholesterol, and I have shown you results on also of cholesterol in 2 or 3 days, and I always say that in cholesterol there's accumulation of lot of cholesterol and the calcium in the blood, atherosclerosis, arteriosclerosis, because of grief. So if you have that grief, and that becomes very important to understand that which grief, and the patient is not able to take out the grief, and that's why the patient ends up in cholesterol problem. So the remedies for your case, whether it is high and low, you can definitely think about remedies like spigelia, ranunculus, oleander, zincum, and thuja. What remedies for profuse night sweats with strong tachycardia, intense palpitation, never been well since periectomy? This is the cheerful patient mentioned. Yeah, so see, increased night sweat is basically a physiological mechanism of defense in the body, first. And second, you can say palpitation is because of that periectomy. And the patient is cheerful. So I would, as I told you, basically, the patient take the rubric positive. The patient is very positive, and if you seen the rubrics in the positiveness, in this case, few drugs which match in your case, and you should think in that case, of course, then you have to match the thermals also. Think about mercury, think about causticum, think about ozone, and one remedy, think about chocolate. These 4 remedies will suit your case. One of these 4 remedies. Friend of mine, doctor by profession, has been suffering from anxiety in allopathic pills. Doctor says it all started immediately after she got the dose of COVID vaccine. Your guide, yeah. So, Dr. Sharma, you make sure you start with that COVID-19 nosode, because if you have a classical history, you give COVID-19 nosode, give 3 times a day for 3 days, and see the result and tell me. If it works, it's okay. If it does not work, then basically we will repetize the case again. Yeah, you can give digitalis for hypertension. You can definitely give. Basically, what happens? Digitalis is a remedy basically which increases the contraction of the heart. So rather hypertension, basically you can give for conditions where you need more of contraction. That contraction, that in case of CCF and the pulse is low, then digitalis acts very well. In olden days, digitalis was given as a prescription because it contained the active principle digitoxin, and that was considered to be a cardiac stimulator because it causes the contraction of the myocardium. So digitalis basically acts in those cases better, that's why it's a cardiac tonic. Patient aged 40, anxiety, fear alone in house, fear of poverty, worried about the health. After looking up others at this happened after celebrating his anniversary, feels lack of money. He had not earned much in young age. Now what will happen in future? Son is studying yet, even wife is supporting and earning. Case of anxiety, fear of alone. Yeah, so see, if the patient is suffering from anxiety when alone, so this is a very, very important, rubric. You have to take anxiety when alone and fear of poverty. Now, want to be quiet. Okay, so you finish everything, then I'll answer the question. Now, see, if there will be a lot of cases in your practice where the patient would have fear of poverty, but then with fear of poverty, do think about these 2-3 rubrics that you have told, and you have told it very well, that elements from being alone or the patient has company aversion to. That is very important. Now, if you take the rubric, these 2 rubrics, as you have said, and repetize it, there are 2-3 medicines that will come to the repertory chart as far as I see. The first would be arsenic, second would be sepia, and third would be Kalikarp. So one of these three remedies, when you repertorize elements from anxiety when they are alone and fear of poverty, these three remedies, one of the three remedies, you can also ask some more symptoms and confirm the remedy, either arsenic, either sepia, or Kalikarp. Kalikarp, I told you one thing, if you have heard my YouTube live before, what is the importance of Kalikarp? Anybody? I have basically made a video of Kalikarp in the YouTube Matramedica, and have beautifully told how Kalikarp behaves in life and why a Kalikarp develops. Why a Kalikarp? You do see the video in my YouTube, Kalikarp Matramedica of Kalikarp, Essence of Kalikarp. Do see that video, and you'll understand why a Kalikarp develops in. Yeah, responsibility is there, but there is one thing in Kalikarp that is very, very important, and how does a Kalikarp develop? Duty, responsibilities, there are a lot of remedies. So Kalikarp is that. I told you, you do see the YouTube video and you'll understand. In this case, Dr. Baba, we are telling either arsenic, sepia, or Kalikarp. Now, an arsenic, what? Yes, overstretching. Or I can add one thing, easy disposition to overlifting. Easy disposition to overlifting, and that is the crux of Kalikarp. No theories, nothing. Yeah, overlifting. Yeah, Dr. Palak, easy disposition to overlifting, and that is how a Kalikarp develops. You can apply everything, duty, work conscious, everything, but starting is easy disposition to overlifting. In the same way, if you want to prescribe arsenic, I have told you something about arsenic compared to a race of horse, and more important for respiratory apparatus and the lower limb apparatus. Now, the disposition of arsenic is also very important. Arsenic is a person who is indifferent, depressing, anxious, full of anguish, irritable, sensitive, peevishness. This is arsenic. And one line of arsenic you should never forget: the greater the suffering, the greater the anguish, restlessness, and fear of death. What is written? The greater the suffering, the greater the anguish, restlessness, and fear of death. मतलब जितना ज्यादा तकलीफ होंगी, उतनी ही ज्यादा mental stress, restlessness, और मरने का डर. That is arsenic album. That is that. So, so Dr. Baba says there is no restlessness and there is no. So, think about Kalikarp, because Kalikarp persons are always have a tendency to work more without telling anybody. They test themselves and then suffer from these qualities. So you can think about Kalikarp. Kalikarp is a fantastic remedy. Of course, I'm not going to teach you Kalikarp now, but if you have seen Kalikarp, Kalikarp is very close to graphitis and ammonium carb. You know why? Because Kalikarp is a remedy for diseases of old people, for diseases of dropsy, and for diseases of paralysis. When you stretch mentally and physically, then you develop these dropsies and paralysis. You don't get directly paralysis. You get directly paralysis in a few months or few years, then it is not Kalikarp. So disease of old people, dropsy, paralysis, inclined to obesity, because everything is gutted inside and the patient stretches, so the body stretches, inclined to obesity. That's why it is comparable with ammonium carb and graphitis. Do you get Kalikarp? This is Kalikarp. Okay? And you read Kalikarp and it's a fantastic remedy. Okay? Can we go further with further questions? A lot of questions have scrolled up because I don't want to get stuck to a remedy and then I keep on telling you the symptoms of remedy and we forget the basic question answers. So kindly select a remedy for me. I am extremely chilly, hands and feet cold, always sneezing with running nose, very slow, cool, jolly nature. So Dr. Sang, I hope we can discuss, but I strongly feel that whatever questions you ask, so you are that type of personality who is basically very much loved child in Sora. Is it there? In Sora, it is very much loved child. You are very jolly. You take life as it comes. You are very sorry. I feel that way. That so if Sora is beautiful and loved and pampered and very happy, so automatically these symptoms. Yeah. So this is the case. Sora is so important. Sora is very important. So go to your Sora. So a loved child, not pampered child, you say a loved child, a lucky child, uh, child who have been loved by the family, given everything, a beautiful environment, and then so mentally the child is very much like Sorik, has not seen that wittiness, the manipulativeness, the deceitfulness, and suddenly it happens that you are thrown out of the world and everything is so witty and everything is so psychosis. So you try to understand the world and you cannot understand it because you have not seen that type of world, and suddenly then you have eliminations, lot of sneezing, lot of coryza, lot of this, because you have not, the body is trying to show out symptoms, chilliness of the hands and all. So this is your case. So go to Sora and do repetize this, because there are whenever I am telling a remedy, it's very personal. So you can ask me in my WhatsApp, I'll tell you the remedy also. But this is the importance of Sora. So one symptom a patient writes, one condition a patient's right, and then you can automatically understand what was there, from where the patient has come to psychosis and syphilis. You know, just for prescribing, like for, I always tell you, just prescribing for sneezing and coryza and running nose, I never prescribe, because I let the patient tell that do something and get rid of it, because this is Sora. So there's no need for that. Burning feet on urge to pass urine. See, this is now again a very, very important symptom. But burning feet when the with urge to pass urine, exactly concomitant not present, go to the Fatak repertory and you have to take one rubric from there. And what is the rubric in Fatak repertory? What is this symptom called as? Anybody? Anybody? What symptom this called as? Now there are certain concomitants, I told you, that are present but not written in Mater Medica. So in this way you have to go with that associated effects. I told you, I think, once. And then if you go, and then you can get the remedy from there. Associated effect means there are some symptoms which follow with the main symptom but not present in the repertory books, because you can't write every symptom. So I told you some remedies also, associated effects like pulsatilla, like Nux vomica, like arsenic, like veratrum. These are remedies which have basically associated effects, in Fatak repertory is given, or in Boga repertory also. You can go there and get the remedy. In females after delivery, easy leakage of urine. Yeah. So it is so important, to do that muscular exercise. After delivery, there is always relaxation of the musculature. So it's very important to do some regular physiotherapy exercise to strengthen the muscle. After that also, if the patient does not get the relief, then you can start thinking of remedies, and then you can there are remedies where you can think of this, like we have hyoscyamus, we have arsenic, we have sepia, lot of remedies. But then symptoms are important. When is the leakage? More in the morning, in the evening, in the night, during cough, during strenuous exercise. So there are a lot of other symptoms. For lax muscle, do think about phosphorus, ferrum, capsicum. Ferrum phos is important. Willow dorata is okay while coughing. Now see, while coughing, that means when there is a pressure and the patient has symptom. So you can think about cuprum aceticum, china, and veratrum. Opium also. In exercise, you have to think of this, and of course sulfur iode. Cervical pain after sprain, cold, no relief with allopathic medicines, cold wind, heart pressure, heart bed desires, Rustox, no fear of suffering and pain. After sprain, cold aggravates. So whenever you have symptoms after sprain, see the intensity of sprain first, because there are less chances where Rustox should fail. Rustox is such a remedy that it should work. But if you say that the Rustox has failed, I'm surprised how Rustox could fail. But still, if you say the Rustox has failed and still the patient has this pain, you must think 2 or 3 remedies which are very, very important. First is, of course, Rustox, I would say. Second is phosphorus, and third is carboanimalis. You understand? Now, when the patient says that whenever he lifts anything very heavy, and that's why that is sprained, then you think of remedies like Belispar, Ruta, and Calcarecar. I hope you got the answer, Dr. Madan. Yeah. Peeling of palms and feet in change of weather. Don't prescribe. Wait for some time. Don't just tell the patient to just apply Vaseline. Okay, that's all. And because of the change of weather, the body internally also the climate of the body changes. No, so these are symptoms that these are symptoms of that change, and the body is trying to throw symptom that it is changing. It will throw symptom for some time and automatically get better. So let the symptoms go, come and go automatically. There is no need for medicine unless there is a lot of dryness, there is a lot of itching, and there is a lot of abrasion, there are a lot of cuts and oozing of pus, oozing of blood. In that way, then you can think of prescribing some remedies. Only tell the patient to just apply some soothing Vaseline, and tell the patients to not handle detergents, because a lot of patients use detergents or soap have such type of problems. I hope you got the answer. So I am a doctor who basically wants to prescribe less remedies rather than prescribing remedies for everything. Just wait, just give time to the body, automatically everything should start working. If not, then you can think about some working. And I have, I think, told you a lot of remedies where there is a lot of cuts and cracks and fissures on the hands and all, and there are a lot of remedies, and everybody knows some common remedy like petroleum is there, and then graphitis is there, ledum is there, laccus is there, hypericum is there, so there are, silicia is there. There are a lot of remedies. Next, some questions have scrolled up, so I have missed some of the questions. If not, then you can go further. I hope Dr. Madan, you got the answer. If you're not satisfied, you can still ask, because whatever symptoms you have given, the remedy should be phosphorus or ruta. So next, yes, yeah, basic. We have posted few medicines out of India, but the sometimes the courier goes, sometimes the courier does not go also. So you can send your address and I'll try to courier the medicines to you. Okay, you can send your address and I'll check out whether it goes through post or through a courier. But everybody, if you have used the COVID-19 also, do write your feedback. So it will be good for me to understand the action of medicines. Pain from lumbars to both the thighs. See, whenever you are prescribing for pain from lumbar to both the thighs, make sure that your symptom, when you're taking out symptom from the patient, it has to be a bit precise, So because I can tell you remedies where the where the pain goes from lumbar to thighs, and there are a lot of remedies. So understand how is the pain exactly, which is what is the modality, when does the pain increase, when is the pain better. So then I can answer some questions. I think very specific medicines for that. But then if you just want that pain extends down to the thighs, then you can write down some remedies like we have capsicum, we have rustox, we have plumbum, we have pulsatilla. So these are the remedies, pain goes down to the thighs. In fact, nitric acid is there, and Kalmia latifolia is there, guaiacum is there. But whatever experience I have got experience with 3-4 remedies. So for this, you can use guaiacum, you can use kalicarb, you can use nitric acid, and you can use definitely rustox. Pain worse from standing, from sitting. Yeah, you can. So these remedies basically would work for you. Do think, or you can take a simple rubric that pain extend downwards. So till the knees, because or above the knees, because that part is the thigh part, no. So you can take a general rubric for that, and then you have to see that the thigh part, the anterior of the thigh or the posterior of the thigh, the medial side. In homeopathy also, for example, if you see the anterior part of the thigh, then we have remedies like pulsatilla, rustox, plumbum, and coffea. In your case, take a generalized symptom, lumbar to thigh or lumbar to going downwards, guaiacum, kalicarb, kalmia, nitric acid. Patient goes to sleep on left side, then lying on the back, rolling to right side, and after this lying on the stomach. So do I have to interpret as no position in giving him comfort? Uh, uh, of course, if the patient tells you that I have got a very unrefreshing sleep, you know, if the patient is telling you I have got unrefreshing sleep, then you can take this rubric. But I have seen in lot of cases where the patient changes position frequently, and this is basically not because that she's not happy. That's the innate and genetic constitution of the patient, that the patient changes the position frequently. And then we have the symptom in the remedies, like we have arsenic album, a very very important remedy. But I have got very good results with three remedies which are very very interesting. The first is Hippar sulf, the second is Jupitorium perfolatum, and the third is Natrum sulf. Of course, don't miss out arsenic, where it is written the patient changes the position frequently. And the patient says if the sleep is unrefreshing, then you can take the rubric that the patient is basically not what you have written, that the patient, any position, give him comfort. But don't take this. Take only the patient changes the position frequently, and in that case you have these 3-4 remedies, very very interesting remedies. So take this for prescription rather than what I told you. That's what you have told. On what grounds do they choose the potency LM? Don't be confused with LM potency. Make in your mind, if Hahnemann has written in 6th edition of Organon that whatever I have written about the potencies before is all wiped off. Now this potency which I have discovered or try to use this in any condition, whatever you are using it before, because it causes minimal aggravation. It can be repeated. It can be repeated so much every 10 minutes in acute disease, and it has no aggravation. That was the Hahnemann's motto of basically using LM potency. And why LM potency? Because he feels that whatever potency the patient is taking, whenever you give 10 strokes, that means he is using he is basically increasing the potency what was there before. So body gets a new kick, a new stimulus every time he takes the medicine, and that's why LM potency has to be used. And if you use LM potency and if you find that the patient is now better, you can stop it, and then gradually when the patient feels again the same thing, you can repeat from where you have stopped. That's why LM is used, and LM can be used in nosodes, in sarcoids, in any. There's no problem. You can use nosodes also in LM potency. It has no problem. I do use some nosode like carcinogen. I've told you in your case only. I've given one of your patients carcinogen, and I strongly feel that she'll improve. Perictomy patient with severe hot sweats, palpitation, tachycardia, and positive outlook. What about using cactus? See, Cactus grandiflorus basically has a very, very. First of all, I'll tell you some remedies that you think about in these cases. So whenever you are having this type of symptom, and you see, you have got a very very specific questions and a very specific remedy for that. In this case, few remedies are very very important in your case. Of course, cactus I'll discuss remedy, but I'll discuss it later because I don't think this is cactus. The remedy you should think about is, first you should think about is chamomilla, second naxomica, third ignitia, and fourth conium maculatum. Now cactus. Cactus remedy basically, if you have seen in your Matermedica, it has a very very classical sensation that iron bound is, the heart is as if caged, and the patient tries to has a lot of feeling that it is caged, and there is a lot of palpitation. Now that caged feeling is actually, if you see in your Matermedica, is basically you can see that caged feeling in angina pectoris. But there are some cases, there are some cases where the patient feels that he is mentally so much caged. He is mentally so much caged that he is not able to get out. He is not able to get out from that situation. And that's why he feels that everything is so tight in it and he wants to come out of that, but he cannot come out. And that's why cactus grandiflora is indicated. What happens in a lot of cases, we feel that we take the rubric elements from domination, and then we have only few remedies. If you see cactus grandiflorus, it is written the whole body feels as if caged, as if wires being twisted tighter and tighter, as if, so that caged feeling related to mind. In fact, if you see, it is written constriction of throat, of chest, of bladder, of heart, of rectum, of vagina. Everywhere there is a caged feeling brought by slightest contact. And that's why it is more related to mild, and that's a mind. And that's why if you have written palpitations, I'll tell you palpitation why. In cactus, palpitation day and night. The patient day and night tries to fight out, tries to want to get out of the situation, but he cannot. And that's why palpitation day and night, worst when walking and lying on the left side. That is cactus grandiflorus. I hope you understood what is cactus. So in your case, it is after an operation. So cause and this in your case changes. There is a challenge to the body, and the body is now showing symptoms. Means the body is answering in a very snappish way, in a very violent way. Hot perspiration, palpitation, pain. So think about chamomilla, think about noxomica, think about conium maculatum, or think about ignitia. And you'll be surprised, if you see Mater Medica, all the four remedies have palpitation. All the four remedies has perspiration which is hot. So everything matches in your case. I hope you understood. I hope everybody understood what is cactus grandiflorus, both mentally and physically. No, see, cage has been removed. But mental cage, he has removed. Mental cage is there, no? You could do a lot of operations and treat a lot of things in the body. You could treat, because of the grief silent, you can have cholesterol problem, you treat it, then he has blockage, you can treat it, again blockage. The mental thing is not taken care of, no. That's why. The body is reacting after an operation, that is important in your case, where the perspiration is out, the patient is chilly, lot of palpitation, and that's why one of these remedies you should take care of. Always say, think of Sora. What was there in Sora? Match that, and then you get the remedy. Yeah, Dr. Navjot, yes, very good. Physically and mental, very nice. Homeopathy, it's an evolve. Every day in your practice, you have to evolve. You can't say that I know the remedy now, I know this remedy, I know that remedy. Every remedy comes to you with some surprises, because our fixation of a remedy has been so much that we cannot think beyond that. See, when you start thinking beyond that, automatically everything becomes very, very clear in your mind. That's why if you see in cactus grandiflorus, causation, it is written from disappointment in love. And the patient, what is cactus? Sadness, taciturn, melancholy, and hypochondrosis. That is cactus grandiflorus. So this is how you have to remember, no, cactus. Patient has fear, pain, and severe. You can use that in cactus. But I'm just trying to tell you how you should remember a remedy. It's a very plain remedy, but that is a mental block, Of course, it is definitely use a remedy for a weak heart and all, but that's why that it is there. But this is more important. I hope you understand, and then try to apply that in practice. So you will get fantastic results, And see, where there is constriction, everywhere in the body there is constriction. That is important. So much constriction, so much the patient, is that I told, like one of the remedies I told you in my one of the webinars. There are emotional wires around the patient. Emotional wires bound, and that's the remedy starts. And that's why, a cactus grandiflorus patient, you'll be surprised to know that because of this lot of stress, family, whatever, the patient basically loves solitude. Loves solitude. And see, when you have a heart problem, you want everybody to with you. But a cactus grandiflorus always loves solitude, because mentally he feels relaxed and happy that nobody is there. That is cactus grandiflorus. So let us go for some other remedy. Anxiety of conscience, excited easily. Okay, fine. So let us go with some other question. Don't stick me in mater medicum, because when you stick me in mater medicum, then I keep on speaking sometimes, and I don't get off the remedy sometimes. Yes. So can we have some other questions? Anxiety of conscience is a very, very important rubric. Okay, no, there is, see, what practice I do, there is no need to antidote. If your remedy is right, it would work unconditionally. So if you feel the remedy is wrong, wait for 2-3 days, give your similimum, it will work. No need to antidote. Chronic recurrent headaches, migraine, headaches before menses and other times. Yeah. So migraine, such a painful condition, such a painful condition. In migraine, one thing is very important. Now you will be seeing a lot of cases, where the patient comes and tells you that whenever the lady comes and tells you that whenever she has a head pain, it is basically before menses. And then you open the repertory, open the mater medica, and you see that aggravation before menses, and there are few remedies which are very, very common. And the first remedy everybody thinks about is pulsatilla, because it is a fantastic remedy. Menses headache pain, menses before. Or you can think about lachesis. You can think about pulsatilla, lachesis, lycopodium, creosote, natrum. But I have seen these remedies basically sometimes they work, sometimes they don't work. Migraine or headache is because of the dilatation of the arteries. And whenever you give a remedy like naproxen or migranil, it causes constriction, and that's why the pain is better. Do ask in your cases of migraine where the patient, why is there so much of stress and dilatation, so much of excitement in the body? If you can pinpoint that part in your practice, and you will have fantastic results in migraine. I do have a lot of cases of migraine. Maybe tomorrow I'll show you some of the cases of migraine in our webinar, Dr. Tony. That migraine, for years and years of migraine, I had cases of migraine for 20 years, 30 years, which is so better. We have to pinpoint why did the excitement start, why there was so much bloating or so much distension of the arteries, so much pulsation and all, like glonine, nitroglycerin type headaches. So in this case, you can think about remedies like, you can think about pulsatilla, you can think about lachesis, you can think of creosote and lycopodium natrum. That is menses before there is pain, you can think about this. But it is important, when does the patient get better? If the patient comes and tells you that I am better when the flow begins, then think about 3 remedies which are very, very important. First, of course, is lachesis. Second, I have found very good results with millilotus. If you have not used millilotus and only thinking about zincum metallicum and lachesis, you have missed a very, very important remedy. Millilotus is a very, very interesting remedy when the patient comes and tells you that my headache is better by when the menses starts. Or you can say the headache is better by bright red hemorrhage. That is millilotus. So think about millilotus. That's a remedy which is, I think, not used or sometimes underused. where it is symptom written, the headache is better when the flow of menses starts. So if this is your case, I think you should try the remedy. What rubric should you consider? No fever, 36.5. Patient feels having fever, warm sensation. Oh, the patient, yeah, millilotus. The patient can't think anything, Dr. Madan. Patient can't think anything. Patient think that he has fever, he has not fever and all. We have to consider why is the patient thinking in such a way, and whether that thinking is hampering the patient's working. Otherwise, a plain dose of phytam also, tell the patient to take your phytam in hot water in the morning, cold water in the evening, and in the night directly. Change. Automatically, if he's feeling that way, he'll feel better also, I do give different types of placebos, and the patient should feel better, because there is no need to give medicine in this case. That's why. Desire for alcohol, okay, you are trying. Swelling of breast, yeah, this is also very common symptom. Frontal headache, tried CPR, natrium, like not, yeah, so high constitution. So think about millilotus, because desires alcohol, which aggravates. No, that is very surprising, that the patient desires something, and if he eats that, it aggravates. So you can say, rather than going there, you can say disordered by taking alcohol. And the whole constitution, basically, he has a problem. So now then, in repertory, we have, there are other symptoms also then, that, for example, I'll just give an example. Wine aggravates. And whenever wine aggravates, you have to think about 3 remedies which are very, very common. First is income mortality. See how your case, how symptoms you're putting, Dr. Tony, and how the remedies are coming, Zincum metallicum, wine aggravates. Before menses aggravates zincum metallicum. Better during the flow, zincum metallicum. So the remedy is matching. Second remedy, wine aggravates, think about gelsemium. Third remedy, wine aggravates, think about Naxomica. See how one remedy is again coming and coming. So in homeopathy, that is the plus point, that whenever one remedy is there, it is there everywhere. So this is the beauty of homeopathy. If you get that case, and automatically starts. For example, if your patient comes and tells you that alcohol aggravates, from alcohol, in that also, Dr. Tony, you have to think about zincum metallicum, lachesis, Naxomica, and you have to add one remedy, that is ranunculus bulbosus. So in your case, 3 remedies are coming in all the rubrics: zincum metallicum, lachesis, Naxomica. So this is the beauty of homeopathy. If your symptoms are right, every time the remedy will fall, the same remedy will fall, and you'll be surprised so much that everything is homeopathy. Everything, every symptom you keep putting, and the same remedy keeps coming, and that is the beauty of a prescription. Then you can know surely that the remedy will work. Okay, मिश्रा जी, गुड आफ्टरनून. आप आज लेट ज्वाइन किया आपने. Yes, so I hope this is good. This answers your questions. Can we have some other question? Millilotus. It's a fantastic remedy. If you have not used it, do use in your practice. The patient comes and tells you, okay, I have continuous epistaxis and all, and the headache is better. So bit discharge, the headache is better. Then the remedy is fantastic, Millilotus. Sometimes keep reading, because when you keep reading, automatically everything will come to. In Millilotus, it is written that bleeding ameliorates, vinegar ameliorates, profuse urination also ameliorates. And whenever you get a remedy, a patient, and the patient comes and tells you that whenever I have profuse urination, I feel better, which remedy we think about? Anybody? जब पेशेंट आके बोलता है कि मेरे को बहुत ज़्यादा जब यूरिन होती है तो मुझे बहुत अच्छा लगता है, तो कौन सी रेमेडी सोचते हैं हम? एनीबडी? कौन सा रेमेडी सोचते हैं हम? Gelsemium, very nice, fantastic answer and spot on. Most of us think about gelsemium. But next time, do think about millilotus. A very, very interesting, a very, very important remedy, millilotus. We never think about because our mind is fixed. And when gelsemium stops working, then you go here and there, understand the themes of remedy from different doctors, and then starts prescribing. And poor millilotus is just lying in your medicine box and trying to tell you hi, but you're not telling her hi. Tell millilotus and give the patient, and you will get fantastic results. Thank you, Rubric, for stubborn refusal to consider alternative. Stubborn refusals, no. So stubborn refusals, then you can take a beautiful rubric. It is a fantastic. I'll tell you a remedy. You tell me the rubrics. You tell me the rubric. What remedy I'm talking? The remedy is Calcarea carp. The remedy is Lycopodium, and the remedy is sulfur. Which rubric I am talking about, Dr. Lisa? In relation to what questions you have asked, Before that, Dr. Meera has asked me a question. I'll answer that question also. She has asked me convulsions at night, a 14-year-old boy, Meera, you can write the remedies: Cilicia, Muxol, Artemisia vulgaris, causticum, opium. 5 remedies: Cilicia, Muxol, Artemisia vulgaris, causticum, and opium. Okay. Now back to Dr. Lisa's question. I have told you the remedy: Calcarea, Lycopodium, sulfur. So in relation to your question, what rubric I am talking about? Anybody? In relation to your question, which rubric I am talking about? It is already 1 hour. Stubborn, my fixed ideas. No. You are talking about stubborn refusal to consider alternatives. Refusal. So we can put this, there are some other rubrics also, but these 3 remedies are very important. So we can put this: Calcarea concentrius, Lycopodium hoti, and sulfur bosterus. We have to get that 3 remedies in 1 rubric, so that we can answer Dr. Lisa's question. So I think it's 1 hour up, and we can put this question again in the next YouTube. Of course, tomorrow I can answer the question. Obstinate, basically, see, you are talking more than obstinate. For stubborn refusal to consider alternatives. Here, he's refusing to consider any alternatives. That's the rubric, Or he's telling, if you tell him A, he'll tell you B. If you tell him C, he'll tell you D. He'll not take care of you. That's the rubric for you. So we'll talk either tomorrow or in the next YouTube live. So thank you, friends. Thank you for joining. Thank you for now.